and welcome to our masterclass today on systems thinking. This is a masterclass run by Centre UB, which is the National Centre for Research and Training and Excellence in Understanding Behaviour, funded by the ESRC. During this masterclass, we hope to give you an introduction into systems thinking by giving you some applied insights on what system thinking is so you can consider the relevance of it and how you might go about using it in your practice. So in terms of thinking about what might systems thinking be, what we are looking at in terms of systems thinking, without getting too much into specifics, is that systems thinking you might think about as a discipline. It can also be an umbrella term or framework, a way of thinking about how different parts of society or how different systems link together. It can be used to understand and frame and conceptualize complex relationships within a system. It's a way of looking at how changing one part of the system changes that part of the system, as well as how it's linked to other systems as a whole. It's based on the idea that an action or a behavior does not occur independently, but is part of a series of actions and other behaviors. Terms might be used such as linkages or interrelationships across individuals and organizations. It's about structures and substructures and how they intersect to shape action, activity, and knowledge. So, how might you use systems thinking as an introductory area? Well, some would say it's a disciplinary area. Some would say it's got multiple methodologies, such as network analysis, dynamic systems modeling. And methodologies can be chosen based on need and what methodology is the most appropriate to build the systems thinking capabilities. One top tip we've heard from doing our co-production activities is that systems have emergent properties. And in working with systems, it's also useful to be clear about the boundaries of what is a system and what might not be a system. So who would use systems thinking and who might it be relevant to? Well, the first answer is people dealing with complex problems and multiple perspectives. It could be behavioural scientists working in government, particularly with a focus on a mission-led approach. It could be both quantitative and qualitative researchers. It could be looking at the spatial and temporal scales. You could be from an education background, a public health background, or even planners. So in terms of our session objective today, is really to provide an introduction to systems thinking. The outcomes that we hope that you'll gain from this session is to understand what types of questions or problems might be answered through a systems thinking approach. We want you to know how systems thinking can be used, inclusive of different methodologies, approaches, and/or frameworks. And we hope that you might be motivated to apply systems thinking in your professional context. So the structure of the session, as I've just given, is a brief introduction and an overview of some of the key terms and phrases that are used to describe systems thinking. We're then going to hear from Dr. Maria Mikhail on participatory systems modelling in mental health. Following this, Professor Jessica Pikett will give us an overview of ethics policy advisory systems. And following that, Professor Peter Craftle will give us an introduction to children, young people, and compound crisis. In all of these presentations, you'll have an understanding of systems thinking. And while not all of the presenters necessarily directly associate themselves with systems thinking and have variability in their approaches, they can give you an idea of how they might start to think in a systems way and how they might apply that to their research to address some complex and challenging problems. So following this introduction now, I will hand it over to Dr. Maria Mikhail for the first presentation on participatory systems modelling. After that, we'll have a brief panel discussion at the end of all three presenters and followed by some Q&A. During the session, if you have any questions that you want to ask, please pop them into the Q&A chat and we'll do our best to address these at the end. So I'll hand over to Maria now. Thank you very much, Maria.
Thank you, Vicky. Bear with me as I share the slides. Just give me 1 second.
That's okay then.
Can you see the slides now?
Too zoomed in and zoom back out to where you were.
So you can see the slides now, yes?
Yeah, might want to zoom out a little bit because it's zoomed in
Ah,
too far. It's cut off the top bits.
okay, just give me a minute.
There you go. Yeah, that's it.
Okay. Okay, thank you for the introduction. My name is Maria Mikhail. I am an associate professor at the University of Birmingham. I sit within the School of Psychology, and I'm the deputy director of the Institute for Mental Health. And the case example that I present to you today is around the application of systems thinking in a very specific approach around participatory systems modeling in mental health and specifically in suicide prevention. So and this forms part of a program of work that's been funded by the EU around exploring the role of systems thinking and specifically systems modeling when it comes to informing policy and practice in suicide prevention. So the program is called CMORE, and it's about system dynamics modeling for suicide prevention. It's been running in the UK and Australia. And this is a key question that we are aiming to answer. Which programs, policies, or interventions across health and community settings can generate the most significant impacts for youth suicide prevention in Australia and the UK? And this program of work was funded in order to develop and validate a system dynamics model that can help inform the most appropriate combination of population level suicide prevention interventions, policies, or programs, developing an implementation plan for the adoption of the model as a decision support tool in youth suicide prevention policy and practice, and then bringing the knowledge from that we've carried out in Australia in the UK in order to adapt and validate the model and explore how it can inform policy, system level inform, and service redesign in relation to youth suicide. So this is the team that's been involved in this piece of work over the past 3 years in the UK and Australia. So we're talking about systems thinking today, and we've heard Vicky talk about complexity. And suicide, along with self-harm and suicidal behavior, is what we call intractable public health problems. They are complex issues, all linked to a gradual and increasing buildup of vulnerability. And this vulnerability is associated with multiple interacting and interrelated factors, whether these are psychological, cultural, social, political. So to just put it simply, there are many and different pathways that could lead to suicide and suicidal behavior. And this equifinality means that mapping the causal pathways and the processes that underlie suicidal behavior, at least within the context of our current methodological approaches, such as static models, such as regression models, for example, can be quite challenging. An additional problem that we have is around the complexity of our health and social systems, where there are many moving parts. And again, it can make it difficult to know how to intervene, where best to intervene, and how to allocate limited resources, and how the impacts of programs and interventions introduced into the system might play out over time. And then we've got on top of that the complexity of different types of interventions. Do we intervene at the individual level, at the community level, at the wider societal level? Do we invest in universal interventions or selective interventions or indicated interventions? And to compound that, then we have the complexity of young people's needs, which are ever evolving. So in light of this complexity, how can systems modeling and simulation help us make the best policy decisions? So, understanding this sort of dynamic complexity of the etiological factors that underlie suicidal behavior requires what we call a shift in the way that we are thinking. And systems thinking, and particularly system dynamics modeling, is ideally suited when it comes to addressing those sort of complex interplays that underlie suicidal behavior. System dynamics modeling is a computer-assisted method that helps us frame, test, and simulate complex systems or behaviors in order to inform policy making. I'm not going to go into a lot of detail about the technical aspects of system dynamics modeling. That's beyond the remit of this presentation. But I will highlight that it is underpinned by the mathematical theory of nonlinear dynamics, and it can allow us to model interacting and interrelated risk and protective factors in order to understand the likely trajectories and pathways of suicidal behavior, whilst at the same time considering health systems, the complexity of our health systems, and constraints within our health and social systems. So it's ideally suited for understanding and modeling policy. And the way it works, as you can see here on this slide, is a very iterative approach. How do we go about developing complex systems models? So we work with stakeholders in order to what we call conceptualize a model or conceptualize a system. So we develop conceptual models that represent what is happening in the system. Then we use these conceptual models or mind maps, however you want to call it, to build computer models that represent and simulate complex systems. When we are happy about the validation of these models, then we test the impacts of different interventions and policies. But alongside that, we're always thinking about implementation. The unique selling point, however, of this particular approach is the participatory modeling. It's the focus on participatory modeling to inform strategic decision-making in youth suicide prevention. So systems modeling lends itself nicely to a participatory approach whereby we invite and we work with an interdisciplinary group of stakeholders. And you'll see in the particular example that I will show you today, those with lived and living experience of self-harm and suicidal behavior, policymakers, health professionals, family members, not just for them to share their views, but also to be actively involved in mapping and contextualizing causal mechanisms that underlie complex systems behaviors. So it allows stakeholders the opportunity, stakeholders from diverse backgrounds, the opportunity to share their views, but also to be actively involved in the model development process. And this is really important because when we are developing models that can be used as decision support tools, there needs to be transparency in how these models are developed and how they are conceptualized. One of the key challenges, however, that we have is how to systematically document and evaluate collaborative, deliberative processes, such as participatory modeling, in order to capture how knowledge and learning is generated and the potential influence of relational and social dimensions as part of the decision-making processes. And this is really important when we are working with a diverse group of stakeholders, of which members of these might be stakeholders whose voices have long been neglected due to perceived sort of safety issues. And in our case, young people with lived and living experience. So the example that I will present to you today, we embarked upon evaluating the feasibility, value and impact of adopting a participatory systems modeling approach to develop a complex systems model for northwestern Melbourne, and then using the learning to inform the model development process here in the UK. So these are the three key questions that we sought to answer through our evaluation. Is it feasible to develop systems models through a participatory approach? What is the value or what is the added value? And what changes as a result of the participatory systems modeling approach? So this study took part in northwestern Melbourne, which is an area of, includes some of Victoria's most socioeconomically disadvantaged and culturally diverse areas. It's about an area of approximately, the population is about 2 million people, with projected to reach 2.5 million by 2030. So a rapidly increasing population and very culturally diverse. The first thing that we did was to partner up with our primary partner agency, and this was the Northwestern Melbourne Primary Health Network. So primary health networks in Australia are independent organizations funded by the Australian government in order to coordinate primary health care in the region. And it was very important for us to ensure that the model identified, it met the local needs and local priorities. So we met with the representatives of the Suicide Prevention Unit within the Northwestern Melbourne PHN in order to identify and discuss the needs of the population, the priorities of the region, to discuss the modeling and the purpose. And also they've been incredibly invaluable in helping us identify the relevant stakeholders that we needed to engage. And you can see in this slide what we call the expert stakeholder group and the different stakeholders that were involved in the model development and evaluation. So from young people with lived experience all the way to service commissioners and service planners. So the starting point was the three participatory systems modeling workshops that took place over a period of 6 months. In the first workshop, we got all stakeholders together and we did an introduction in terms of systems modeling, what it is, how do we use it. Then we worked with our stakeholders in order to map the likely trajectories of suicidal behavior. So how do young people become distressed? Then how this escalates to the point that young people may engage in self-harming behavior or suicidal behavior. Mapping young people's help-seeking journey, both through health and non-health settings, and also prioritizing different interventions or policies or programs for testing in the model. And as you can see, this was a very iterative process. So we always brought the model back to the stakeholders to review the logic of the model, the structure of the model, and this happened over a period of 6 months. So we started with what you can see on the left-hand side, a very simple diagram which we used as a prompt. And over a period of 6 months, we developed this very elaborate, conceptual map that you can use here. We can see here on Butcher's paper. We used different post-it notes for different stakeholder categories because we wanted to preserve anonymity, but at the same time, we didn't want to lose what young people wanted to say and record, and what family members or what policymakers. And then we took this conceptual map, and this was developed into a computational model. So we've translated all the different variables that you can see in the map into a computational model, which we've shared again with our stakeholders to ensure the model logic and structure of the model. So how we documented stakeholder involvement. So we used a number of different knowledge elicitation methods, from sort of small group discussions to larger facilitated discussions. And for divergent tasks, we used, for example, such as brainstorming ideas, we adopted the nominal group technique. For convergent tasks, for example, when it comes to prioritizing interventions or policies of interest for testing in the model, we use the voting exercise. All the workshops were audio recorded and transcribed, and we used thematic analysis in order to analyze the data and answer our 3 questions in relation to evaluation around feasibility, impact, and value. So there are 3 key themes from this process. The first one was around ways to facilitate effective stakeholder working, benefits of stakeholder involvement, and changes to the model following stakeholder feedback. So I'm going to walk you through the different themes at the moment and provide some illustrative quotes. So ways to facilitate effective working. One of the key things that came up was around facilitative leadership. So you can imagine it was a very diverse group of stakeholders. with different power and social dynamics within the expert stakeholder group. So, and observations of participants' behaviors and interactions highlighted the presence of, dominating voices in the room. And this was manifested in different ways. For example, attempts to lead or navigate the discussion towards a certain path, or taking control of the conversation, referring to one's position and experience as a way of influencing conversations. But participants also identified good examples of practice in terms of facilitated leadership on how to manage those power and social dynamics, such as having clear ground rules, facilitators picking up the signs when someone is trying to dominate a discussion and using this opportunity to bring the group back, ensuring that all voices are heard, and specifically ensuring those what we call a circular flow of knowledge. Improving inclusivity and accessibility of the technical aspects of modeling is also a very robust sub-theme that came up. As you can imagine, we had to use a lot of technical language, which we've managed to sort of distill by using sort of summaries and user-friendly ways such as charts and figures. But still, one of the things that it came up both from the stakeholders and also from our field notes and observations is that we might have, because of this sort of use of technical language, we might have inadvertently excluded some voices from the room. Improving diversity and cultural representation was key within the expert stakeholder group. And this was something that participants spoke extensively, particularly during the first workshop, referring to certain groups of young people not represented in the expert stakeholder group. And you can see here a quote that encapsulates this. Cultural representation is important. If you cannot bring on the table certain groups of young people, then we can talk about bringing in people who work with young people to make this representation better. The second theme was around benefits of stakeholder involvement. With regards to the sharing and exchanging knowledge that took place. So it was through this process of dialogue and debate that stakeholders had the opportunity to discuss their disagreements, ask questions, and find resolution collectively. And it was this process of collaborative learning that helped to connect knowledge across the expert stakeholder group and also foster quite an in-depth understanding and awareness of our system, which was invaluable for us as a research team. And importantly, the role of lived experience in informing the participatory modeling approach. And you can see here one of my favorite quotes actually from this piece of research. We had one allied health professional that talked about the importance of us involving young people in this process. A young person's experience or story is different from collecting data at a single point in time with very specific questions. Stories give context to the data and help see how it is different from another person's story. Stories add dimension. Data that you would get from a questionnaire or other type of psychometric measure from two people might be the same, but there are two different stories and contexts. And finally, we've got the changes to the model following stakeholder feedback. So stakeholders provided unique knowledge on how the health system and specifically the mental health system operates in their region. And this knowledge was used to inform, review and revise both the structure of the computer simulation model, the logic and the assumptions underlying the model. And importantly, stakeholders worked collaboratively to identify weaknesses in the systems that could be used as leverage points where one could intervene to optimize the system behavior. So this was around sort of impact and change of the model. And you can see here again another quote that refers to how many different points in the system where young people spend a lot of time waiting. So participants highlighted how we have to have specific sections of the model need to reflect the fact that young people wait to be seen both when they are between services, but also within the same service. I'm not sure if we're going to have time to play this video. I'll be guided by you, Vicky, in terms of where we have time. It was an interview that we had with our one of our youth advisors who took part in the participatory model process.
Yep. Go ahead, Maria. It's fine.
Okay, so I'll play part of it.
I was wondering, what was your experience of the workshops? Things that worked well, things that we could improve in the future.
Yeah, like I said, like I loved it. I loved being able to share my experience and know that I'm doing so to help other young people in the future. And yeah, I think the workshops ran really well. So I really liked how we'd split off into different groups. So we'd have like small table discussions, and that way we could share ideas with people who were like us as well. Like I know I was on a table with other young people, which I think helped as well for us to be able to share our experience and not feel like we're speaking to professionals and whatnot. And then that really helped when we'd come back to the group discussion. I was able to talk on behalf of other young people who were a bit quieter and less, a bit more apprehensive to speak in front of everyone. And then I think it was also great how we had the opportunity to write things down as well. If we weren't comfortable saying in front of everyone.
I think one of the things that we are very passionate about is sort of advocating and highlighting the importance of involving young people like yourself and your peers in research that could directly impact them. Young people could benefit from them. And taking into consideration some of the sort of the logistics, the practicalities, and the ethical considerations, but also really promoting the idea that young people need to have a voice. And I was wondering how you found that experience.
Yeah. Well, the sad thing is a lot of the time young people don't have a voice and they don't get to share, their experience when it comes to this type of research. And yeah, I thought this was an amazing opportunity because finally, we were able to have our say and tell the researchers directly, this is what we want, this is our experiences, this is what we can see would be helpful. And I think that's really important.
I will stop it here because I'm mindful of the time. But there has been many concerns around the feasibility and sort of the ethics and safety concerns around involving young people with lived experience in suicide prevention research, particularly research that can be quite technical. And this is why we've deliberately sought to consult with young people about about the meaningful involvement in this piece of work, both in terms of managing risk and risk mitigation, but also enabling their participation in a way that it highlights their agency and is quite empowering. And you can see the QR code there of where we've written with young people about the importance of youth participation and involvement in suicide prevention research, and focusing particularly on and moving beyond the importance of moving beyond those, the safety discourse or those safety concerns that sometimes exclude young people from this process. And I will just finish here with some important sort of take-home messages when considering the feasibility, impact, and value of developing complex systems models through deliberative processes such as participatory systems modeling, the importance of considering cultural representation and diversity, the importance of generating and sustaining inclusivity, important things such as facilitative leadership, and acknowledging and respecting different and complementary types of expertise when we have a diverse group of stakeholders, how lived experience can meaningfully involve the model development and evaluation, and also something that we found as a research team sometimes a little bit tricky in how to incorporate the technical aspects of the workshop and stakeholders' social insights. So I would leave it here, and I'll thank you very much for your attention. And this piece of work was just hot off the press, just been published last week, and you can access the paper, open access, through this QR code. And thank you so much for your attention.
Thank you, Maria. That was great. So we will move on to the next case study presentation from Professor Jessica Pikett on ethics in policy advisory system. Thank you.
Thank you, Vicky. I hope you can see my slides okay there.
Yeah, we can see them.
Super. So thanks very much, Vicky, for the invitation to participate in this panel and this masterclass. I'm Jessica Pikett, and I'm a Professor of Social and Political Geography and Co-Director of the Centre for Urban Wellbeing at Birmingham University.
Jessica, we can still see your notes and the slides down the side. I don't know if you want to click the slide.
Okay, yeah, sure. I haven't got any notes, but make it bigger so that people can see.
That's it.
Is that better?
Yeah, great.
Super. Yeah, and I'm at the University of Birmingham, and also I am a co-investigator on the ESRC Centre for Socio-Digital Futures as well. But today I'm going to just give you a bit of an overview of a research project that I'm working on, and talk a little bit around 3 different ways of approaching systems thinking that we're exploring in this project. So the project is another ESRC funded project, Economic and Social Research Council, over 3 or 4 years, and we're about halfway through this project currently. The project is called Ethics and Expertise in Times of Crisis, and it's a collaboration across 5 different universities and international collaboration with Germany and Australia. And we also have a partnership with the National Nuffield Council on Bioethics on this work. The impetus for this project came during COVID, when it became clear that the governance infrastructures, the ways in which ethics advice is provided to governments worldwide, was not necessarily being followed. So a lot of debate at that time around whether the kinds of specialist expert advice from ethicists was being followed by UK government, German government and Australian government. So in the UK, the Nuffield Council of Bioethics, former council member, wrote an article in the BMJ saying, why have we got these ethics panels if no one's going to follow their advice? Similarly, in Australia, it was one of the bioethicists in the health ethics advisory panel said, why is everyone ignoring us? Isn't it worse to have an ethics panel and then ignore it or treat it in a symbolic way rather than not have one at all? And even in Germany, where there's a national statutory body given the power of the Bundestag or Parliament to give formal ethics advice, there was a perception that the ethics advisory systems in public health were weakly networked and coordinated, and therefore leading to all kinds of policy missteps and failures. So the project is really about learning these lessons from this original case study of COVID. We published a few papers in journals like the Journal of Risk, Hazard and Public Policy and Evidence and Policy, using documentary analysis to understand why those lessons weren't being learnt. And we also identified particular gaps for thinking about policymaker capacities and institutional capacities and capabilities and skills. So thinking about why is it that policymakers and civil service across these different countries aren't necessarily equipped to navigate ethics advice or navigate value-based types of evidence. There's a lot written in the literature around science policy advice, and the whole policy advisory system very much dominated by science, and during COVID very much dominated by epidemiology and mathematical modelling, but very little is written in the literature on ethics advice. So this is the gap that we were trying to fill. And recently one of our researchers was invited to UNESCO in Paris to talk about the research in relation to a new code of practice or code of conduct for research ethics, specifically during times of pandemic crisis. We distinguish ourselves from this kind of from 2 things mainly. From research ethics, we're not doing a project about research ethics, we're not doing a project about codes of conduct or professional codes of conduct and ethical behaviour amongst policymakers. But we have been certainly researching and carrying out lots of interviews with both ethics advisors to governments and people who are soliciting, commissioning ethics advice from governments. So this is what our objectives: to understand why governments request ethics advice and what they do with it. So why do they sometimes not follow it? What are the competing processes and pressures which are getting in the way? And ultimately what are the outcomes in terms of for citizens? And we have a particular interest in health inequalities as well. We're doing that across 3 international cases in order to compare across different nations. We're interested to map out a future for ethics advisory systems, so thinking about what the ideal types would be and consulting widely with ethics experts on this, and to do something useful to help support policymakers and civil service professionals to navigate value-based decisions in the policymaking process. So developing policy tools and resources for that purpose. The questions we're asking are some quite basic empirical questions because not a lot is known about how the different national systems differ and what are the key characteristics that make ethics advice and its governance work in some contexts and not others. We want to try and understand what makes a moment an ethical moment rather than a legal, regulatory or political moment. So how do these issues and challenges, ethical challenges, get chosen by ethics committees, by government officials soliciting that kind of expertise? We're then interested in what's the evidence around whether ethics advice has had any impact in government situations and shaping policies and then having outcomes for citizens. And then how can we better support policymakers to navigate these issues? So those are our key research questions. I'm not going to talk in any detail about the empirical findings. What we have done is interviewed 60 people across 60 policymakers and ethics advisors across these 3 different nations, and also done some international scoping interviews as well for international bodies. We've run 5 witness seminars or group interviews around particular ethical moments. We've done stakeholder mapping and documentary analysis. But just to give some really top level findings, what we're finding is that the national differences do matter in the way in which ethics advice is organised. We still are kind of developing various criteria and a typology for what characteristics, what kinds of forms and cultures of governing create a kind of good ecosystem of ethics advice in a national context. We're finding that global challenges and intersecting crises require new kinds of expertise. So the kind of post-war kind of evolution of bioethics committees is being increasingly contested. Very much bioethics and public health ethics have been dominating, and clinical ethics to a certain degree have been dominating government debates around ethics. But there is now a whole plural fields of things like ecological ethics, feminist ethics, lots of different sociology is becoming more, social research becoming more valued as forms of kind of sources of ethics and expert advice in governments. So there's a pluralization. Advocates for ethics systems in government do have ideas about what the ideal system could look like. They call for more embedding of ethicists in policy making. So just in the same way as we have chief scientific advisors, there's a whole cadre of government social researchers within the UK national government. There are calls now for chief ethics advisors to be embedded in departments, or for the ethics, to the mainstreaming of ethics in the policymaking cycle and the policymaking process. There's calls for more ethical preparedness, so developing the capabilities and skills of policymakers, and more plural perspectives, as I mentioned. Also, a kind of call for more integration, the call for less fragmented, more integrated system. However, there does remain a huge amount of disagreement as to what ethics knowledge actually is. How is it different to politics, regulation, and legal knowledge, for instance? What constitutes credibility in terms of ethics expertise, and what is the nature and the processes of giving advice? So what we're interested in is this, in the diagram at the bottom here, in the Venn diagram, the ethical advice space, which takes into account kind of value claims, but also truth claims, what we can claim to know, and how do we navigate those value assumptions and making those visible. We're also interested in defining ethics as a form of public reasoning. So it's not just a body of knowledge, but a set of processes and ways of thinking about values and about truth. So we think that the distinctive features of ethics knowledge versus scientific knowledge, for instance, require different kinds of systems of advice. We were looking at 2 specific case studies, and those are One Health or planetary health and AI ethics and healthcare. So again, this is about taking one set of circumstances around the COVID pandemic and applying the learning beyond that to these new case studies. And both these case studies share between them a focus on thinking beyond human systems. So the One Health agenda, for those who don't know, is defined as the kind of interconnectedness and interdependence of living systems and environments. Planetary health is slightly different to that, in the sense that this is about safe and just Earth system boundaries, a more ecological approach, which is already, these boundaries have already been surpassed. So we're already in a situation which we've surpassed the safe and just boundaries of ecological living as humans. And we need to rethink our whole systems and have radical transformations. So it's inherently a critical perspective on and points to the government, well, national governments, global governance failures in terms of ensuring planetary health. So there are conceptual overlaps, but they're different kind of networks, different definitions, different cultures of expertise. They're both concerned with systems, that kind of ecological system or the health system, non-human life. And they also are critical of current regulatory systems and the lack of integration. They require new forms of knowledge and the integration of different kinds of knowledge. So One Health, for instance, you think of antimicrobial resistance, you can think of animal health, and kind of veterinary science coming into that, but also public health and population health coming into that as well. And with planetary health, you would add into that climate science, ecological and sociological and socio-ecological systems thinking. So there is a kind of inherent systems thinking within these agendas in terms of questioning the boundaries of thought that have generally shaped our thinking. And they have different framings of what counts as technical expertise, different orientations to justice and rights. Our other case is AI ethics in healthcare, which is, again, involves different kinds of systems, technological systems and healthcare systems. And here we're interested in what are the promises of AI in terms of what it's proposing to solve in terms of the public health crisis in various countries, the experimentalism that is being brought in with the rolling out into the wild of AI systems without sufficient regulatory frameworks. And there are implications again for ethics expertise and the way in which new kinds of fragmented forms of specialist expertise in AI ethics are coming to the fore here. And some concerns around the funding behind ethics experts in this field. So this is a very politicized area. So again, another system rears its head here, the political system. What we're doing with all this work is thinking about what kind of new skills are needed in these new kinds of what called and sometimes overused phrase, a polycrisis, the integration of different kinds of crises having cumulative effects. This survey by Apolitical of global civil servants conducted in 2024 asked what kind of skills do policymakers want? And interestingly, systems thinking is very popular as a skill that people want training in, which bodes well for this masterclass. But on the top there, you can see it's identifying and framing problems, which is the top skill that policymakers wanted to develop. So the question here then for us is, how can systems thinking fulfill this need? So go on now to just talk about 3 brief perspectives on systems thinking as related to this research that I've outlined. So the first example is a kind of very basic stakeholder mapping, systems mapping of the ethics advisory ecosystems or the governance systems around COVID. So during the COVID inquiry, this systems map was published by The Guardian, which was described as a bowl of spaghetti. So this kind of bowl of spaghetti was to convey the complexity, the unmanageable, uncontrollable complexity of all the ways in which different bodies, public bodies, private bodies, government agencies were working together or linking or being connected in some way. And this was seen as a real problem. It was too messy and too complex a system to manage and led to some of the policy failures that we saw in the UK. So that is an example of where systems can become too complex to be manageable. We also have done our own stakeholder mapping, and although you can't see the detail here, the important point is to look at the shapes. So we've mapped ethics advisory bodies in the UK, Germany and Australia. We can see here the UK has a very dispersed system. So the Nuffield Council on Bioethics is not a government body, it's an independent body somewhere in the middle. But you can see around this kind of centre of networks, there are all kinds of dispersed bodies as well, with different forms of expertise related to different kinds of sectors. In Germany, there the Ethikrat, or the National German Ethics Council, is highlighted in red there. But again, although it's formally a centralised system, there's a kind of gaping hole in the middle, so that it's not kind of it's not a kind of hub and spoke model of central control. And similarly in Australia, very much informally networked, hardly any connectors between bodies themselves, very much dominated by sector-specific, either public health or AI type of ethics, but little coordination between them. And at the moment, there is a kind of call within Australia to set up a national ethics body. You can, if you are able to access these slides, hopefully we share the slides later, you can have a look at our institutional maps, which we've made and explore in detail. The second way of thinking about systems thinking in relation to this project is to think about what kind of systems of skills or capabilities, institutional systems. How can we go beyond this kind of big picture analysis towards understanding how resilient systems will be in the face of crisis? And for this, we turn to literature from policy advisory systems, so from kind of public administration literatures, which focus on the effectiveness of advice, and that is often in relation to how internal or external it is to government. So both have its pros and cons, and there's a lot of controversy around the use of consultants in central government, but certainly there are dynamics around internal, external systems of advice. There are interesting things to be said about the content and the temporality of these bodies. So how do they choose what issues are deemed ethical, but also are they kind of ad hoc bodies, or kind of responsive bodies, or are they permanent institutionalized bodies? So there would be obviously a benefit to having more long-term bodies in terms of job security, in terms of integration and mainstreaming of ethics advice. And then polycentric, so how diverse are the kind of centres of control? So the reason to take the systems thinking in this direction is to go beyond that kind of big picture national comparisons to situational analysis, to thinking about what is working where and why. So there are some synergies here with methodologies like realist methodology in public health research. There is an assumption here that fragmentation is bad, integration is good, and that's being challenged by many public administration scholars and policy scientists currently. Sometimes fragmentation can work in terms of diversity, pluralization of knowledge, and the resilience and adaptiveness of particular systems. And there also are some really interesting debates currently around whether we should be thinking about the skills that public servants need today and how they might be different in view of taking this systems-based approach. So lots of stuff about systems leadership, some recent interventions by people like Catherine Needham, colleague here at Birmingham, who's talking about stewardship and diplomacy. So thinking beyond this kind of heroic version of public sector leadership towards stewarding complex systems and diplomacy, but in terms of creating an environment for collaborative governance. So we've developed this framework looking at different cultures of expertise and thinking about how do these things work, how do they operate, their operative capacity, how do they frame problems, their discursive capacity, and adaptive capacity, how do they respond to crises. The final way of thinking about systems in this project is in terms of relational ecosystems. So again, there are critiques about the overuse of the metaphor of ecosystems in relation to understanding governance. But here we use the term ecosystems because we're very much interested in thinking about how governance, how we as humans are also animals, and how we live in communities, whether we, this is why we have governments, in order to live better together. So we're very much focused on the ecosystem approach. So we talk about the ethics policy advisory ecosystem in this research. It highlights interdependence rather than some ideal type of independence or autonomy. So it doesn't take for granted that autonomy or individual rights or individual privacy are the most important ethical issues for human dignity. It talks about interrelations and interconnections. And these, just given a few examples of where these ideas come from and how they've been applied in relation to relational public health, relational welfare, and relational public administration. And the key point here is that it's a focus on how relationships matter and what are the power dimensions of those relationships, and how do they, issues of inclusion, for instance, that Maria was talking about, but also issues of justice claims and how they are enacted. So we think that this focus on ecosystems and relationships helps us to identify ethics practices in relation to policymakers, the working practices of civil servants, and ultimately the governance infrastructures that are produced. And there's some really good examples, if you're interested in this topic, to follow up on emergent kinds of forms of ethical thinking. For instance, at the University of Bonn, the Centre for Life Ethics, which is taking this different kind of worldview of non-human and human relations in terms of government ethics advice. And this is run by the former chair of the German Ethics Council. Finally, if you're interested in this, how could you get involved? We think it's really important to pay attention to who counts as an ethics advisor. How do you get involved with soliciting ethics advice as a policymaker? What kind of questions should you be asking? Where can you look? So we've been working with the Nuffield Council on Bioethics and also the Faculty of Public Health to develop training on ethical insights, a rapid ethical assessment tool, guidelines, reviewing various kinds of existing ethics tools and checklists. We're aware that civil servants have very little time on their hands, and we want to make sure that we're co-producing that tool. So we're co-producing it with Faculty of Public Health, but we're also opening up consultations over the summer, dates in July and September, that will be available for you to join if you're interested. So you can join one of these deliberative workshops, and I'll stick the link into the chat when I've finished. But certainly you'd be very welcome to join our Ethics, Evidence and Policy Network through this route. So I'll draw that to a close, and I'm going to pass over, end of my slideshow, and pass over to Peter Craftle, who also at the University of Birmingham in my department.
Thanks, Jessica.
Would you like to take the floor?
Yeah, would you mind stopping sharing your screen and then I can...
Oh yes, that would help, wouldn't it?
That's all right.
There you go.
Thank you very much. Hi, everyone. I'm just going to set up my slides. Just check that those are visible. Great, thank you. So my name is Peter Craftle. I'm Professor of Human Geography at the University of Birmingham. As Jess said, I work in the same school. I work with children and young people doing predominantly qualitative research about their experiences of and learning about their environments. As I'll come to show in a moment, although I'm not someone who engages with systems thinking in the formal disciplinary sense that Vicky outlined at the beginning, my work does explore various forms of complexity, crises, and what Jessica called polycrises, which are becoming increasingly in focus. And my work is perhaps a little smaller scale than that which Jessica outlined, but is also about considering the direct role of children and young people themselves as agents and their voices, particularly within research, but in the context of these compound crises. So when I think about these crises, I'm interested in these complex, intersecting, compound crises that particularly affect the lives of children and young people. And I say particularly because young people are particularly vulnerable to and disproportionately affected by some, if not all, of the kinds of crises that are on the slide there. There have also been identified generational injustices and inequalities in terms of the current and future generations of children and young people who might be vulnerable to these kinds of crises. And there are also temporal dimensions here, whereby we seek interventions in terms of these crises and at the intersections of these crises now, not only for children and young people and their environments right now, but because of how they may be affected in the future. So thinking about these kinds of crises as determinants of health, of well-being, of prosperity, of learning, and of other outcomes. My own work is mainly around the top three there, around safe environments and resources, climate change and its impacts, and various health crises. And I'll say a little bit about those in my presentation. So what I want to do in my presentation is focus mainly around methods, particularly qualitative research methods, through which we can gain a sense of the complexity of some of these systems and crises that centre around children and young people and their lives. I'll first of all focus on the idea of visual nexus mapping as a way of getting at the heart of some of those issues, and in that thinking about the centrality of children's voice and agency. I'll then move on to a second project, which is around climate change and how trees and a focus on tree planting might mitigate climate change, but particularly with a view to thinking in a more transdisciplinary sense and also to decentering children and young people. And I'll say a little bit more about that a little later on. So in the first, one of the ways in which I've undertaken systems thinking without it being called systems thinking as such is through the idea of the nexus. And alongside systems thinking, this is perhaps a more recent terminology which has been used to describe complex systems, particularly of resources. So here, nexus thinking at a global scale and a regional scale has been a way of considering externalities across a range of sectors, particularly the WEF nexus, or water, energy, food nexus. The focus has been on the efficiency of different systems and on potential trade-offs that might exist, for instance, where crops may either be grown for food or for energy. So where there are trade-offs and decisions to be taken around the intersection of these different resource systems, and particularly around challenges there. And this work has been embodied in the work of a range of UN organisations in the development sector, particularly in Latin America, and also in a number of policy documents. But what's important and interesting from my perspective, and I'll come back to this in a moment, is rather than thinking about how this can be thought from the top down, so from the view of governments or from urban policy perspectives, from the bottom up, from the everyday lives of those people who live at the intersection of those kinds of sectors, such as water, energy, and food. And this has been called the domestic nexus. Before I come to that, though, I guess it's useful to show another bowl of spaghetti, as Jessica termed it. This is just one way of visualizing the water, energy, food nexus. But this is very much from the top down, and you can see here how human life and the sort of middle underneath water there is already sort of decentered to an extent. And so, as I mentioned earlier, what I'm interested in here is a bit of a recentering of human life, a recentering the domestic nexus of everyday life, and particularly the perspectives of children and young people in terms of how they view themselves at the intersection of these sectors. So I'll just provide a snapshot of our research and can provide further details if required as we have our discussion. So a few years ago, I co-led a research project in Brazil, which involved research in total with over 3,500 young people. I'll say most about the qualitative and app-based research, which is what I'll be focusing on today in my example. So in this work, we created a mobile phone app that enabled children and young people with their phones to take pictures of water, energy, and food in their everyday lives. They could then enter some brief text about that in the mobile phone app. And from there, we engaged in a process of mapping with each young person, of nexus mapping. It's easiest to show you this by showing you an example. This is an example from Isabel, a young university student who lived in a small university town in the state of Sao Paulo. And you can see that what we did here, quite practically, was to try and map out aspects of the nexus. We stuck on images from the app. I realize this is much more analog than digital, but we found that this analog process with paper and pens worked actually much better, whereby young people could then map out the intersection of water, energy, food, and other elements of their own personal nexuses as we talked with them. And that last point is really key here, because what this enabled us to do was to complicate the notion of the food, energy, water nexus. So in this example, Isabel was a university student and found it very difficult to access food from local supermarkets because of the cost, and also to move around her community because of fears around safety. So for her, this process identified that it was her bike that she was able to purchase, which was the kind of center point, a point of articulation for her personal nexus. Because it was her bike that enabled her to get to university safely, that enabled her to access cheaper food, and that enabled her to sort of stitch together various aspects of her life in a more positive way. So the first point I want to make really is that this is one approach to thinking about how we can do these forms of complex systems thinking with actors, with, in this case, children and young people from the bottom up, to address, if not solve, at least to address and broach and critically consider issues like the water, energy, food nexus. This does, though, leave certain questions. One is, once we've collected all of these stories, and Maria mentioned the importance and power of stories, how do we overlay them onto each other? How do we compare them? Because they're all so different and contextualized. The other issue that we identified was also one of disconnections. So systems thinking is very often about connections that are made, relationalities, relations between things. But what about when those relations break down? And in particular, for young people living in more monetary poor environments in Brazil, unlike Isabel, it was those disconnections that were actually just as important. So how do we think about those disconnections, particularly in the lives of the more marginalized? Okay, so that's all I want to say about that approach, really just a quick flavour. The second project that I'd like to talk about involves, to an extent, a different kind of complexity and also a bit of a decentering of children, although they will be important in what I have to say. In this case, I'm interested in a more recent research project, which was about children and young people, particularly from diverse urban communities and their relationships with trees. And it was about moving beyond the idea of communicating to children and young people why trees and why tree planting matter for carbon sequestration and climate change, to understanding their own interactions with trees. It was important also to recognise that this was a transdisciplinary project involving researchers from the social sciences, arts, humanities, and the sciences, and also practitioners, including community foresters, schools, and other educators. So this project was about starting with trees. So it was, to an extent, about decentering children from the process as much as hearing their own voices. It was about how else we can think about children and trees beyond telling them why trees matter in their everyday lives and beyond environmental education. So the work involved transdisciplinary research with over 650 diverse children and young people, particularly in the northwest of England and in Scotland, educators and tree practitioners. And it involved co-research with children and trees as participants. And there's a QR code there if you'd like more information about the project. But what I'd like to talk about is how we mobilised children and young people and trees in the process of the co-production of research, which bore in mind all of this complexity. So these different disciplinary approaches, the different views of these different practitioners, as well as children and young people themselves. And how it also paid attention to the agency of trees and other aspects of the ecosystem. And what I'd specifically like to talk about is the process through which we worked in the schools as groups of academics and practitioners coming into classrooms to co-design tree planting schemes in school playgrounds and in urban environments near to the schools. So we went through this cyclical process, which I've simplified greatly here, but which again is kind of exemplary of the complexity of the system and our approach, and one which sought to get beyond the simple communication of why trees matter in a scientific sense. So we would begin with children's everyday knowledges, asking them about how they played with trees, the trees that were in their local environments, telling us stories about trees from family histories. We would then talk about some of the scientific elements, explain how trees can capture carbon. And then we went through the cyclical process of co-designing with them a treescape nearby their school. And you can see in the image there on the left, one of the sort of outcomes of that co-design process, which then led to some more formal planting schemes on the right there. But important to us was this constant co-design process, which wasn't only about children and young people's views, or only about the scientific process, or only about the process of tree planting. It was this ongoing iterative process. And what was important to us about this was that it enabled a proliferation of activity. So instead of being so concentrated on what trees can do for us, we started with the trees and the planting, but weren't confined to it. So we found that, for instance, on the left, children and young people very quickly developed a whole range of techniques and repertoires for actually planting trees. They even invented a new tree dance, which was enabled them to get the trees into the ground. And on the right here, we used an approach where children and young people acted as co-researchers in the process, collecting data with us. And here we have children and young people putting worms onto their notebooks to think about how they might also make marks, and to think about how they are valuable aspects of the ecosystem. And what this enabled us to work through as we planted the trees, we've now planted thousands of trees in different school grounds and different environments, was the whole range of ways there are to measure trees, why they matter to us, and why they matter beyond their utility for humans and for sequestering carbon. So again, we thought about this whole complex interconnected patchwork of ways of measuring trees, and we've recently published an article about the 1,000 ways to measure a tree. These range from literally hugging a tree to measure its diameter at breast height, to using more simple geometric tools to capture the size, diameter, height of a tree, to using LiDAR laser scanners, which cost several tens of thousands of pounds, and exploring with children and young people the kind of outputs from those. But also the whole range of activities that went on around these processes of measuring trees as we were outside, telling stories, children telling us about trees that mattered to them, and also imagining the future of trees and treescapes. And so one of the things I wanted to emphasize here was not only the method, but some of the outcomes here. So we were keen that our approach didn't kind of get over, but looked beyond eco-anxiety and some of the more troubling narratives around the environment that children and young people are exposed to think about kind of more speculative, hopeful futures with trees. So we thought about how education is really a kind of hopeful practice, enlarging the space of the possible. So this proliferation of different methods, these complex methods, this transdisciplinary approach, we're about enlarging how we educate children about trees rather than zooming in and focusing only on formal scientific knowledges. And from there, we've developed a whole range of resources and practices, including on our website, a whole range of toolkits and guides for how within schools and beyond, we can take this more enlarged approach, this more complex approach. I wanted to leave you just with one final example because it speaks again to these notions of polycrises. So one of the groups we worked with were a group of asylum-seeking young people in Manchester who had recently arrived from Eritrea and from Afghanistan. And we undertook a program of work with them as youth researchers, where they did a range of arts-based methods, including photography, tree walks. They engaged in various skills-based activities. But one of the things that they wanted to do was to create this tree of hope from the photography exercise that they did. So this was a group of children, young people who were, if you like, really at the centre of a range of crises, at the centre of polycrises. Not only climate change, but also the forces that had made them move and seek asylum in the UK in the first place. And they created, on the basis of this kind of complex constellation of activities, this tree of hope, based on the Oda tree from Oromo cultures in Eastern Africa, a space of dialogue, a space of encounter, and a space of coming together. And really, this is quite symbolic, a kind of nutshell, if you like, of our approach. A kind of hopeful approach that brings out the opportunities that can arise and the outcomes, the positive outcomes that can arise for thinking through in a more complex way with young people these kinds of polycrises. So those are the two methods that I wanted to talk about, the visual nexus mapping approach and this approach to starting with trees in a transdisciplinary sense. And again, I've just added my contact details there, but I'll hand back to Vicky now for the discussion.
That's fantastic. Thank you. And thank you to all of our speakers today. It's been really interesting to hear about the applied insights of systems thinking. So we're going to briefly touch on a couple of questions of a panel discussion. I think in your presentations, we've all seen what the benefits are of applying a systems thinking approach to answer different questions and complex problems. One of the things that we hear about in terms of systems thinking is it's hard to engage with, or the perception is that it's hard to engage with. So I wonder if you could tell me, each of you, what would you identify as a key barrier to using systems thinking and how might you overcome that? So I'll go to Maria first.
Thank you, Vicky. It is definitely a challenge, particularly when you're working with a very diverse group of stakeholders, both including those with experiential knowledge and those with professional knowledge. And one of the things that we have tried to do to break down some of those barriers in terms of how do we grapple with, complex terms, particularly when it came to our example around systems modeling and sort of the dynamics modeling and all the sort of the technical bits is we were very much informed by the insights of our stakeholders. In terms of how do we, the sort of terminology that we are using, the methods that we are using in order to introduce that terminology. For example, in system dynamics modeling, we use one of the key principles around stock and flow diagrams. So we've actually got to work with our stakeholders in order to develop a very simple, complex systems model using a stock and flow diagram. And it was building blocks like this that we used in order to ensure that our stakeholders were meaningfully involved. And we didn't always get it right, as you can see, from the findings of our study. But where we didn't get it right, this is where it was really important of that sort of two-way communication of being informed, and our stakeholders did a really, really good job to identify things that we didn't get right. Particularly when it comes to, accessibility and inclusivity, because of the high technical concepts that we had to deal with. In terms of the facilitation, the team that helped, so we had people who had subject expertise, sort of self-harm and suicide. We had epidemiologists and data scientists, but also facilitators who could help break down those technical aspects into small sort of chunks of information.
Thank you, Maria. Jessica, do you have anything to add to that?
Yes, I think one of the main barriers is this uncertainty as to the meaning of systems thinking and the variety and diversity of systems thinking. So kind of academic purists might want to go back to, mathematics, complexity theories, and that's very specific kind of technical knowledge there. But I think anyone in a kind of position of decision making in government will want more usable and applied approaches. But I think it does create this situation which some people are using the term systems thinking to describe the nature of a problem, like a wicked problem. Others using it to describe systems of decision making or governance. Others might be looking at systems thinking in terms of impact and implementation of a particular kind of initiative or program. So there's a lot of not necessarily misunderstanding, but a range of understandings of what this thing called systems thinking actually is. And then, as Peter and Maria's talks highlighted, there are different methodologies that you could use. They're kind of very technical modeling methodologies, but also participatory kind of methods. And then finally, there might be some gaps from systems thinking. So one of the barriers is trying to understand, what does taking the systems perspective do in terms of, it does shed light on particular ways of seeing social processes, but it can also have some gaps and omissions. So it can tend to exclude some kind of aspects. It can potentially kind of fall back on this notion that everything is connected and complicated and relational. Whereas the important thing is what are the strengths of those connective tissues? What are the actual relationships, and how do they intersect with issues of power? And what are the driving forces? So there's a tendency to suggest that all elements of the system are equally contributing to something, but actually we know that some things are restructuring other kinds of phenomenon. And I think that's really important to keep hold of.
Thank you, Jessica. And Peter, anything to add to that?
Yeah, just to build on that quickly, I think particularly when doing systems thinking or similar methods with communities, and particularly kind of the groups such as children and young people, there are three things to bear in mind. One is time. So because of the complexity of these issues, it can take time to use the kinds of methods that we're using. And of course, we were lucky enough to be able to work in some schools that provide us that time, but that's not always available, particularly in organisations like schools. Secondly, there's the resource. So our work was very resource intensive. Our academic investigators alone numbered 21, and that was then added to the various other partners that we had. So highly resource intensive, although we could argue that once the methodology is in place, it wouldn't require so many people. And then scale and scalability is the other issue here. So how do you, as I mentioned earlier, upscale from these individual stories to tell something that's compelling at a larger systems scale, and vice versa? So what are the processes of translation that are required?
Thank you. And we've had a question come in from the Q&A, which was also one that I was going to ask as well. It would be, what is a key resource or an author that you would recommend for someone to learn about systems thinking? So I know a few links have been shared. Is there one key thing that you would turn to or use that's framed your thinking? I know you will share some papers, but is there one key where you would recommend someone turn to? Maria, do you want to go first again?
Yes, absolutely. So I would recommend the work of Donella Meadows. So is one of the key sort of leading figures, was in systems thinking. One of the sort of my go-to book would be Thinking in Systems, which is Bible when it comes to systems thinking and complexity. So I would highly recommend her work. Yeah.
Thank you. And I see, Jessica, you put in the chat a link. Do you want to explain what that is?
Yes, that's a link from a public health professional who's got all kinds of instructional videos on his method of ripple effects mapping, which is very useful for mapping the effects of interventions. The other thing I would mention, I'll put a link in the chat, is a political scientist called Paul Kearney, who he's got this brilliant blog. He summarizes everything in 200 words or 750 words. So if you're short on time, you can read a very short version of his papers, and he's written a lot about systems thinking for government officials. Put that in.
Thank you, and very interesting to read it in such a short format. I think is good to know. And Peter, would you have I see you've just popped something in as the chat as well.
Yes, so a really good article on critical nexus thinking, which explores some of the tensions involved in thinking about the nexus at different scales, is the one that I've just mentioned there, and which I think is free to access.
Thank you. Well, I've certainly learned a lot today from listening to our speakers. I want to thank you all for presenting today. And in terms of the people listening or watching later down the line, I hope this has given you a good introduction to systems thinking. I think you'll be able to understand the types of questions or problems that might be answered, how systems thinking could be used in terms of different methodologies, approaches, or frameworks, and ultimately, we hope you've been motivated to use systems thinking, because as you can see, it can answer really interesting questions and allow you to look at different aspects in your work and research. So that brings us to the end of the masterclass. We will be focusing on systems thinking in future sessions. Your learning does not end here, so there will be, as I said, there will be future webinars and masterclasses. And please do look out for these on our mailing list, but also on our website. And just to highlight, at the University of Birmingham, we do have a systems thinking master's degree. And if you are interested in that, then please do get in contact with Centre UB and we can put you in the direction for that. We do evaluate our training with the purpose of ensuring that it is engaging, impactful and relevant. So please do, if you can, complete the feedback survey. It will take you 5 minutes of your time. You can scan the QR code here, follow the link, or as a participant of this webinar, you will receive an email after this asking you to participate in that, and we do really appreciate that. But I will end today with a big thank you to our speakers, and I hope you enjoyed the session on systems thinking and you've learned a lot from this session too. Thank you very much.